All right, so you guys sent over a mountain of material on preventative and corrective oral appliances for this deep dive.
Yeah.
I mean, we're talking dental school, lectures notes, excerpts from professional manuals.
Wow.
So pretty clear you're ready to move past just brushing and flossing, huh?
Definitely.
So let's dive into this world that goes way beyond just those pearly whites. You know what I mean?
Well, and what's so interesting about all these appliances is they can really have like a domino effect on your overall health.
Oh, really?
Yeah, we're talking sleep, jaw function, even your self-esteem. Like, it's all connected.
Okay, so let's break that down a little bit.
Yeah.
Let's start with something I think we've all seen at like the sporting goods store, right? Those mouth guards.
Sure.
Your notes mentioned like stock, boil, and bite, custom fit. What's the deal with all those options?
Well, think of it like shoes. You know, you wouldn't wear just a generic ill-fitting pair for a marathon.
Right.
Same goes for protecting your teeth, especially in contact sports where those impacts can be surprisingly forceful.
Oh, yeah, for sure.
So a custom-fit mouthguard crafted from an actual mold of your teeth, that's going to offer the most precise and comfortable protection.
That makes sense. That makes sense. But what about for those of us who clench or grind our teeth?
Right.
My dentist has mentioned like a night guard before.
You're talking about bruxism there.
Yes.
It's way more common than you think, affects about 8% of adults.
Oh, boy.
And those grinding force, I mean, we're talking hundreds of pounds of pressure.
Really?
Over time, this can lead to some serious issues like fractured teeth, TMJ disorders, and even tension headaches, especially if you're grinding those masseter and temporalis muscles all night.
Oh, wow. That's intense. So is a night guard then just like a heavy-duty mouth guard?
They serve a similar purpose, creating a barrier to protect the teeth. But night guards are designed specifically for those forces of bruxism.
Oh, okay.
They're often made from more durable acrylic or thermoplastic materials like ethylene vinyl acetate, which is known for its shock-absorbing properties.
Oh, okay.
And just like with any oral appliance, you know, proper cleaning is key.
So no more tossing it in that glass of water on the nightstand, huh?
Exactly.
Speaking of things that we might not expect at the dentist's office, let's talk about sleep apnea.
Sure.
I see, a lot of material here on obstructive sleep apnea, or OSA.
Right.
Isn't that more of a sleep specialist thing?
It definitely is a sleep disorder, but dentists play a crucial role, especially when it comes to mild to moderate OSA.
Interesting.
Essentially, the muscles in your throat relax during sleep, causing your airway to narrow or even close completely.
So you're saying my dentist could help with my snoring?
Well, those loud snores are a sign that your breathing is being obstructed,
Oh.
which can lead to drops in blood oxygen levels and daytime fatigue.
Hmm.
So there are oral appliances that can reposition your jaw and tongue, helping to keep that airway open while you sleep.
Okay.
Think of it like a gentle nudge that just keeps everything flowing smoothly.
I never knew dentists were involved in sleep issues.
Yeah.
So what causes OSA in the first place? Is it just about being overweight?
Obesity is definitely a risk factor, but it's not the only one. Anatomical factors like a larger neck circumference or a recessed chin can contribute, as can chronic nasal congestion, smoking, even genetics.
Huh.
And yes, men are about twice as likely to develop OSA as women.
So it's not just a matter of willpower. There are actual physical factors at play.
Exactly.
Are oral appliances the only option for OSA? Though I've heard of those CPAP machines?
CPAP, or continuous positive airway pressure, is the gold standard for moderate to severe OSA.
Right.
It involves wearing a mask that delivers pressurized air to keep your airway open. Oral appliances are often a great alternative for milder cases or for people who just can't tolerate CPAP.
Okay, so if someone suspects they might have sleep apnea, what's the first step? Do they run to the dentist or to a sleep specialist?
Ideally, both.
Okay.
A sleep study is the most accurate way to diagnose OSA, but your dentist can be a valuable resource for discussing your symptoms and exploring those treatment options.
Okay.
They can even refer you to a sleep specialist if needed.
Gotcha.
It's all about teamwork.
Okay, so we've gone from preventing broken teeth to helping people breathe better at night. Dentistry is way more involved than I ever realized.
It really is.
All right. So let's shift gears to something that mainly affects kids now, space maintainers.
Okay.
I'm looking at some diagrams here, and these little devices seem pretty simple.
They might look unassuming, but space maintainers play a critical role in a child's dental development.
Yeah.
Imagine a child loses a baby tooth prematurely. The surrounding teeth can start to drift into that empty space, creating a domino effect that can lead to crowding and misalignment of those permanent teeth.
Oh, so they're basically placeholders for adult teeth.
Yeah.
I'm guessing this is all about avoiding braces down the road.
That's a big part of it. By preventing those early shifts, space maintainers can save a child from a lifetime of potential orthodontic issues and the costs that come with them.
Right.
But it's not just about aesthetics. If a child loses a tooth too early, it can also affect their chewing ability and even their speech development.
Wow, I hadn't thought about that. So how do these space maintainers actually work? Are they all the same?
There are two main types, fixed and removable.
Okay.
Fixed space maintainers are cemented to the adjacent teeth, kind of like tiny braces, while removable ones are similar to retainers and can be taken out for cleaning.
Right.
The choice depends on the specific situation, the age of the child, and their comfort level.
Makes sense. So it's not just a one-size-fits-all approach. It's
Right.
about tailoring the treatment to the individual child.
Exactly.
And this leads me to another topic that often comes up, braces. But what I'm really curious about is Invisalign. Everyone's talking about those clear aligners these days.
Yeah, you're talking about the invisible revolution in orthodontics.
Huh.
Invisalign has definitely changed the game. Instead of metal brackets and wires, you have these clear, custom-fit aligners that gradually move your teeth into that desired position.
So they're basically invisible braces. That sounds too good to be true.
They're definitely more aesthetically pleasing, but the real advantage is that they're removable. You can take them out to eat, to brush and floss. Talk about a win for oral hygiene.
That's a huge plus. But how do they actually move teeth? Is there some kind of magic involved?
It's not magic, but it is pretty high-tech.
Okay.
They use sophisticated 3D imaging and computer-aided design to create a series of aligners that gradually shift your teeth over time.
Okay.
Each aligner is worn for about 2 weeks before switching to the next one in the sequence.
Okay, so are there any downsides to Invisalign? It seems like the perfect solution.
Well, like any orthodontic treatment, it requires commitment.
Right.
You need to wear the aligners for at least 20 to 22 hours a day for them to be effective.
So no sneaking them out for hours at a time.
Right.
What about cost? Is Invisalign typically more expensive than traditional braces?
The cost can vary depending on the complexity of your case and the length of treatment, but it's often comparable to traditional braces. Some dental insurance plans even cover Invisalign now.
Oh, wow. Good to know. So it seems like Invisalign is a viable option for a lot of people.
Yeah.
Are there any cases where traditional braces might be a better choice?
There are definitely situations where traditional braces might be more effective, such as cases involving severe crowding complex bite issues, or very young patients who might not be able to manage the responsibility of removable aligners.
Right. That makes sense. So it's not always about choosing the latest and greatest. It's about finding the best treatment for your individual needs.
Yeah.
I'm realizing there's so much more to orthodontics than just straightening teeth.
Absolutely. It's about creating a balanced, healthy bite, which can have a huge impact on your overall oral health, your jaw function, and even your self-confidence.
This is all incredibly fascinating. Before we move on, though, I have one burning question about Invisalign.
Okay.
If you're constantly taking them out to eat, doesn't that make them easier to lose?
That's a valid concern. It's
Yeah.
definitely important to store them in their case when you're not wearing them and to be mindful of where you place them. Some people even use a designated travel case or a brightly colored retainer cleaning container to make them harder to misplace. But overall, most people find that the convenience of removable aligners outweighs that risk of losing them.
Okay, that's reassuring to hear. So it seems like there's a solution for every concern when it comes to these appliances. Now let's dive into another important topic. Palatal expanders. Those sound pretty intense.
They can be, but they're also incredibly effective, especially for addressing certain types of bite problems. Imagine the roof of your mouth, your palate being gently widened over time. That's essentially what a palatal expander does.
And why would you need to widen the palate? What kind of issues does that address?
Well, sometimes the upper jaw isn't wide enough to accommodate all the adult teeth, leading to crowding crossbites or even breathing difficulties. A palatal expander helps create the space needed for proper alignment and function.
Crossbites, that's when your upper teeth bite inside your lower teeth, right?
Exactly, and it can cause problems with chewing, speaking, and even jaw joint pain. A palatal expander helps create a wider arch in the upper jaw, which can correct the crossbite and improve that overall bite.
So it's not just about making the smile look nice, it's about addressing functional issues as well.
Right.
This is making me think about bruxism again. Can orthodontic issues like a crossbite actually contribute to teeth grinding?
That's a great question, and the answer is yes. They definitely can. If your bite is misaligned, it can create stress on your jaw muscles and teeth, which can lead to clenching or grinding, especially at night.
Wow. So in some cases, correcting those alignment issues could actually help reduce or even eliminate bruxism.
Yeah.
That's a game changer.
It's definitely a possibility. Of course, there are other factors that contribute to bruxism, like stress anxiety and sleep disorders, but addressing bite problems can be a key part of that solution.
Okay, so we've got palatal expanders, cross-bite correctors. What about thumb-sucking deterrents? I have a feeling this one is pretty self-explanatory.
You're right, the name pretty much says it all, but the interesting thing is that while thumb sucking is a natural reflex for babies and toddlers, if it persists beyond a certain age, it can start to affect the development of the palate and the alignment of the teeth.
I can see how that would happen. Constant sucking could create pressure on the teeth and the roof of the mouth. So are these deterrents meant to break the habit before it causes any lasting damage?
Exactly. They work by either making thumb sucking uncomfortable or impossible. Some are fixed appliances that attach to the teeth, while others are removable and can be worn at night.
It's amazing how many different types of appliances there are, each one tailored to a specific issue. It's like a whole toolkit for creating and maintaining healthy smiles.
And that's what makes dentistry so fascinating. It's a blend of art and science where we use these tools to address both the functional and aesthetic aspects of a smile.
Speaking of beautiful smiles, let's circle back to Invisalign for a minute. You mentioned that they're great for oral hygiene because they're removable. Can you elaborate on that?
Absolutely. With traditional braces, food particles can easily get trapped around the brackets and wires, making it difficult to brush and floss effectively.
Right.
This can lead to plaque, buildup cavities, and even gum disease over time.
That makes sense. So with Invisalign, you just pop the aligners out, brush and floss like normal, and then pop them back in.
Exactly. It simplifies oral hygiene significantly and helps patients maintain a healthy smile throughout their treatment.
That seems like a huge advantage. But I'm curious, are there any downsides to this removability? Could it make it easier to forget to wear them?
That's a valid point.
Hmm.
The success of Invisalign relies heavily on patient compliance.
Right.
You need to wear the aligners for at least 20 to 22 hours a day for them to be effective.
So no sneaking them out for hours at a time.
Hmm.
But are there any specific tips for staying on track with Invisalign?
Definitely one helpful tip is to make wearing your aligners part of your daily routine. For example, put them in first thing in the morning after brushing your teeth, and only take them out for meals and snacks. You can also set reminders on your phone or use a habit tracking app to stay accountable.
Those are great tips. It's all about creating those healthy habits. Now, I'm seeing some information here on retainer care. That's something we should touch on before we wrap up this section.
Absolutely. Retainers play a crucial role in maintaining the results of orthodontic treatment, whether you've had braces or Invisalign. They help prevent your teeth from shifting back to their original positions.
So retainer care is essential for long-term orthodontic success. What are the key things people should know?
The most important thing is to wear your retainer as instructed by your orthodontist. This usually involves wearing it full-time for a certain period after treatment and then transitioning to nighttime wear for long-term maintenance.
Okay, so consistency is key. What about cleaning? Are there any special instructions for keeping retainers clean?
Just like with your teeth, it's important to keep your retainer clean to prevent plaque buildup and bacterial growth. You can brush it gently with a soft, bristled toothbrush and toothpaste, or use a denture cleaning tablet.
So no tossing it in the dishwasher. Are there any other common mistakes people make with their retainers?
One common mistake is exposing retainers to heat. Don't leave them in a hot car or wash them in hot water, as this can warp the plastic and make them ineffective.
Good to know. I've heard horror stories about retainers melting in the dryer. Any other words of wisdom for our listeners before we move on?
Just remember, retainers are an investment in your long-term oral health. By taking care of them and wearing them as instructed, you can help maintain your beautiful, straight smile for years to come.
Well said. It's all about those healthy habits. This deep dive is already proving to be incredibly informative. Before we wrap up this first section, though, I'd love to hear your thoughts on one more thing.
I'm all ears. What's on your mind?
I'm curious about the connection between oral health and overall health. Is there any truth to the saying, the mouth is the gateway to the body?
That's a great question, and the answer is a resounding yes. There's a growing body of research showing that oral health is intricately linked to overall health.
Can you give us some examples of how these two are connected?
Absolutely. For instance, gum disease, which is an infection of the gums, has been linked to a higher risk of heart disease, stroke, diabetes, and even certain types of cancer.
Wow, that's serious. So it's not just about having a pretty smile, it's about protecting our overall well-being.
Exactly, and it works both ways. Certain medical conditions, such as diabetes, can increase the risk of developing oral health problems, so it's a two-way street.
This is all incredibly eye-opening. So it seems like taking care of our oral health is one of the most important things we can do for our overall health.
Yeah.
Any final thoughts before we wrap up this section?
Absolutely. I encourage everyone to prioritize their oral health by brushing and flossing regularly, eating a healthy diet, and seeing their dentist for regular checkups and cleanings. It's an investment in your overall well-being.
Well said. This deep dive is off to a fantastic start. We've already learned so much about the world of preventative and corrective oral appliances. We'll be back soon with even more insights and answers to your burning questions. Stay tuned.
Yeah, that was a great discussion about the link between oral health and overall health. It's really fascinating how interconnected they are.
It really is. It makes you realize that taking care of your teeth and gums is about so much more than just aesthetics. But let's get back to our exploration of oral appliances. I'm curious to learn more about those colorful space maintainers we briefly touched on earlier.
Ah, yes, those are a great example of how dentistry has become more kid-friendly over the years.
Okay.
Remember how I mentioned that fixed space maintainers are kind of like tiny braces?
Yeah.
Well, some of them are actually designed with fun shapes and colors to make them less intimidating for kids.
So instead of like a plain metal band, a child could have a space maintainer shaped like a butterfly or a star.
Exactly. It's a simple but brilliant way to make the experience less scary and even a little bit exciting for kids. Some dentists even let the kids choose their favorite colors.
That's such a great idea. It takes away the fear factor and turns it into something fun and personalized.
Mm.
Speaking of personalization, you mentioned earlier that the type of space maintainer used depends on the specific situation. Can you elaborate on that?
Of course, there are several factors that dentists consider when choosing a space maintainer, such as the age of the child, the location of the missing tooth, and the amount of space that needs to be maintained.
Okay. For example, a unilateral space maintainer is used when only one tooth is missing on one side of the mouth,
Got it.
while a bilateral space maintainer is used when teeth are missing on both sides.
So it's not just about filling the gap, it's about choosing the right tool for the job.
Exactly.
This reminds me of something we discussed earlier, the teamwork involved in dentistry.
You're right. On choosing and placing a space maintainer often involves a collaboration between the general dentist, the pediatric dentist, and sometimes even an orthodontist.
Wow, it's a true team effort. And speaking of teamwork, let's not forget the role of the dental hygienist in all of this.
Absolutely. Dental hygienists are essential members of the dental team.
Right.
They're the ones who provide those thorough cleanings, educate us on proper oral hygiene techniques, and spot early signs of trouble.
They're like our personal oral health coaches, and let's be honest, sometimes they're the ones who have to deliver the tough news about needing a filling or maybe even an appliance. But they do it with such care and compassion, they really are the backbone of any dental practice. Now, let's talk about another important type of appliance that's often used in conjunction with braces, or Invisalign, the palatal expander. We touched on it briefly earlier, but let's dive a little deeper.
I'm all ears. As I recall, palatal expanders are used to widen the upper jaw, right?
Precisely. They consist of two halves that are connected by a screw.
Okay.
The expander is placed in the roof of the mouth, and the screw is gradually turned over time, gently separating the two halves of the palate and widening the upper jaw.
It sounds a little intense. Is it painful?
There might be some mild discomfort or pressure during the expansion process, but most patients adjust to it quickly. The benefits far outweigh any temporary discomfort.
Okay.
By widening the upper jaw, a palatal expander can correct crossbites, create more space for crowded teeth, and even improve breathing in some cases.
That's incredible. It's amazing how a seemingly simple device can have such a profound impact. Now, I'm looking at some information here on crossbite correctors. Are those similar to palatal expanders?
They serve a similar purpose correcting crossbites, but they work in slightly different ways.
All right.
Crossbite correctors are typically smaller and more targeted than palatal expanders.
Going.
They might be fixed appliances that are cemented to the teeth, or removable appliances that can be worn for a certain number of hours each day.
So the choice between a palatal expander and a crossbite corrector depends on the severity of the crossbite and the individual patient's needs, right?
Exactly. It's all about finding the right tool for the job. And just like with any orthodontic treatment, the success of these appliances depends heavily on patient compliance. Wearing them as instructed by your dentist or orthodontist is crucial for achieving those desired results.
That makes sense. It's a partnership between the patient and the dental professional.
Mm-hmm.
Now let's switch gears to a topic that might be a little less familiar to some of our listeners, thumb-sucking deterrents. We mentioned them briefly earlier, but let's explore them in more detail.
I'm happy to dive into that as we discussed. Thumb sucking is a natural reflex for babies and young children, but if it persists beyond a certain age, it can start to affect the development of the teeth and jaws.
So these deterrents are designed to break the habit before it causes any lasting damage, right?
Precisely, they work by making thumb sucking either uncomfortable or impossible.
Okay.
Some are fixed appliances that are attached to the teeth, like a little metal bar that sits behind the front teeth. Others are removable and can be worn at night.
I'm imagining something like a mouth guard that makes it physically impossible to suck your thumb.
That's a good analogy. The goal is to break the habit gently and effectively. It's important to note that these deterrents are typically used in conjunction with behavioral therapy and positive reinforcement to help the child understand why it's important to stop thumb sucking.
That makes sense. It's a multifaceted approach. I'm curious, are there any long-term consequences of prolonged thumb sucking if it's not addressed?
If thumb sucking continues beyond the age of 4 or 5, it can start to affect the alignment of the teeth, causing problems like an open bite where the front teeth don't meet when the mouth is closed. It can also affect the shape of the palate, potentially leading to speech problems or difficulty breathing.
Wow. It's amazing how something as seemingly harmless as thumb sucking can have such significant consequences if it's not addressed early on. This reinforces the importance of regular dental checkups for children, right?
Absolutely. Early detection and intervention are key when it comes to oral health, especially for children.
Right.
Regular dental visits allow dentists to monitor a child's development, identify any potential problems early on, and recommend appropriate treatments.
Well said. It's all about being proactive. Now let's circle back to one of the most popular orthodontic treatments. Invisalign, we've already talked about its benefits in terms of aesthetics and oral hygiene, but I'm curious to learn more about the technology behind it.
I'm happy to elaborate. Invisalign uses cutting-edge technology to create a series of custom-fit aligners that gradually move your teeth into their desired positions.
Okay.
It all starts with a 3D scan of your teeth, which creates a digital model of your mouth.
So no more messy impressions with that gooey material.
That's right. The 3D scan is much more comfortable and accurate once the digital model is created. The orthodontist uses specialized software to map out your treatment plan step by step.
So the software actually shows how your teeth will move over time. That's incredible.
The software creates a series of virtual aligners, each one slightly different from the previous one. These virtual aligners are then used to manufacture the physical aligners that you'll wear throughout your treatment.
It's like a digital choreography for your teeth. How often do you typically switch to a new aligner?
Most patients switch to a new set of aligners every 1 to 2 weeks, depending on their individual treatment plan.
Okay.
Each aligner applies gentle, consistent pressure to specific teeth, guiding them into their new positions.
It's fascinating how such small incremental movements can lead to such dramatic results. Are there any limitations to what Invisalign can treat?
While Invisalign is a very versatile treatment option, it's not suitable for every orthodontic case.
Oh, okay.
For example, it might not be the best choice for patients with severe crowding complex bite issues or certain jaw alignment problems.
So it's important to consult with an orthodontist to determine if Invisalign is the right treatment option for you, right?
Absolutely. A thorough evaluation is essential to create a personalized treatment plan that meets your specific needs and goals.
This deep dive is really shedding light on the incredible advancements in orthodontic technology. I'm curious, are there any other emerging trends in the world of oral appliances that our listeners should know about?
There are always exciting new developments in dentistry. One trend that's gaining momentum is the use of teledentistry, which involves using technology to provide dental care remotely.
Teledentistry. That sounds intriguing. Can you tell us more?
Of course, teledentistry platforms allow patients to connect with dentists virtually for consultations, follow-up appointments, and even some types of treatment monitoring. It's particularly helpful for patients who live in rural areas or have limited access to dental care.
That's amazing. It's like having a dentist in your pocket. Are there any other technological advancements on the horizon?
Another exciting area of development is the use of artificial intelligence in dentistry. AI algorithms are being used to analyze dental images, predict treatment outcomes, and even personalize treatment plans.
Wow. It sounds like the future of dentistry is incredibly bright now. Before we move on to our final section, I have a question about something we discussed earlier. Retainers. You mentioned that they're essential for maintaining the results of orthodontic treatment, but I'm wondering, how long do you typically have to wear a retainer?
That's a great question. The length of retainer wear varies depending on the individual case and the type of orthodontic treatment you've had in general. Most orthodontists recommend wearing a retainer full-time for several months immediately after braces or Invisalign treatment.
So it's not just a quick fix. It's about long-term maintenance.
Right.
What happens after that initial full-time wear?
After the initial period of full-time wear, most patients transition to wearing their retainer only at night. This helps maintain the alignment of the teeth and prevent them from shifting back to their original positions.
So it's a lifelong commitment to some extent. Are there any consequences of not wearing your retainer as instructed?
If you don't wear your retainer as directed, your teeth can gradually shift back towards their original positions, undoing the hard work and investment you put into your orthodontic treatment.
Oh, no.
This can lead to relapse where you might need to undergo additional orthodontic treatment to correct the misalignment.
That's a good reminder to be diligent about retainer wear. Any other words of wisdom for our listeners before we wrap up this section?
Just remember, retainers are an investment in your long-term oral health. By taking care of them and wearing them as instructed, you can help maintain your beautiful straight smile for years to come.
Well said. This deep dive is already incredibly enlightening. I can't wait to see what other fascinating insights we uncover in our final section. We've covered a lot of ground in this deep dive. It's amazing to see how far dentistry has come in terms of, both prevention and correction.
Yeah, for sure. We've gone from basic mouth guards to, those high-tech aligners and everything in between.
Right. And we've learned that it's not just about aesthetics.
Yeah.
Oral health is really connected to our overall well-being.
Absolutely. A healthy mouth contributes to a healthy body.
Right.
Now, before we wrap up this deep dive, I want to circle back to something we discussed earlier, the importance of those regular dental checkups.
Yeah, that's a great point.
Yeah.
It's easy to put off dental appointments, especially if you're not experiencing any pain or discomfort. But those regular checkups are essential for preventing problems before they even start.
Exactly. Think of it like getting an oil change for your car.
Right.
You don't wait till the engine seizes up to take it in for maintenance.
That's a great analogy. So how often should we be seeing our dentist for those checkups?
Most dental professionals recommend having a checkup and cleaning every 6 months.
Okay.
This allows your dentist to monitor your oral health, catch any early signs of trouble, and provide personalized advice for maintaining a healthy smile.
What about kids? Is there a different recommendation for them?
Children should start seeing a dentist around their first birthday or within 6 months of their first tooth erupting.
Oh, wow.
Early dental visits help establish good oral hygiene habits, monitor dental development, and address any potential issues early on.
So it's never too early to start prioritizing oral health.
Right.
Now, I'm curious, what are some of the key things that dentists look for during those regular checkups?
During a checkup, your dentist will examine your teeth gums and overall oral health. They'll look for signs of tooth decay, gum disease, oral cancer, and any other abnormalities. They'll also check your bite alignment and jaw function.
So it's a comprehensive assessment of your entire mouth, not just your teeth. What about x-rays? Are those a routine part of every checkup?
The frequency of x-rays depends on your individual needs and risk factors.
Okay.
Your dentist will determine how often you need x-rays based on your age, dental history, and current oral health status. X-rays allow dentists to see what's happening beneath the surface, detecting hidden cavities, bone loss, and other issues that might not be visible during a visual exam.
So x-rays are a valuable tool for early detection and prevention.
Exactly.
And let's talk about one of the most common dental problems, cavities. What causes them and how can we prevent them?
Cavities, also known as tooth decay, occur when bacteria in your mouth produce acids that erode the enamel.
Okay.
The hard outer layer of your teeth, the bacteria, thrive on sugary and starchy foods. So limiting your intake of these foods and practicing good oral hygiene are key to preventing cavities.
So it's all about reducing the fuel that the bacteria need to produce those harmful acids.
Yeah. Right.
What about brushing and flossing? How important are those habits in cavity prevention?
Brushing and flossing are absolutely essential. Brushing removes plaque, a sticky film that builds up on your teeth, while flossing removes food particles and plaque from between your teeth where your toothbrush can't reach.
So it's a tag team effort. Any tips for making brushing and flossing more effective?
Use a soft bristled toothbrush and fluoride toothpaste brush for 2 minutes twice a day using gentle circular motions. Don't forget to brush your tongue as it can harbor bacteria as well when flossing. Use a gentle back and forth motion to clean between each tooth.
Great tips. I think we all need those reminders sometimes. Now let's shift gears to gum disease. It's a term we hear a lot, but what exactly is it?
Gum disease, also known as periodontal disease, is an infection of the gums that can damage the soft tissues and bones that support your teeth.
So it's not just about your gums. It can actually affect the underlying bone structure. That sounds serious.
It is in its early stages. Gum disease is called gingivitis.
Okay.
It's characterized by red swollen gums that bleed easily if left untreated. Gingivitis can progress to periodontitis, which is a more serious form of gum disease that can eventually lead to tooth loss.
Wow, so early detection and treatment are crucial.
Okay.
What are the warning signs of gum disease that we should be aware of?
In addition to bleeding gums, other warning signs include persistent bad breath receding gums, loose teeth, and changes in your bite. If you notice any of these symptoms, see your dentist right away.
So it's not just about pain. There are other subtle signs that something might be wrong.
Right.
This deep dive has really emphasized the importance of paying attention to our oral health.
Definitely.
Now, before we wrap things up, I have a question about something that's been on my mind.
I'm all ears. What's on your mind?
I've heard a lot about the connection between oral health and overall health. Can you elaborate on that?
Absolutely. As we touched on earlier, there's a growing body of research showing that oral health is intricately linked to overall health. For instance, gum disease has been linked to a higher risk of heart disease, stroke, diabetes, and even certain types of cancer.
Wow, that's incredible.
Yeah.
It really drives home the point that taking care of our mouth is about so much more than just having a pretty smile.
Exactly. It's about protecting our overall health and well-being, and it works both ways. Certain medical conditions like diabetes can increase the risk of developing oral health problems.
So it's a two-way street.
Right.
Taking care of our oral health can have a positive impact on our overall health and vice versa.
Exactly.
This has been an incredibly insightful deep dive. Any final words of wisdom for our listeners?
Absolutely. Make oral health a priority in your life. Brush and floss regularly, eat a healthy diet, and see your dentist for regular checkups and cleanings. Your smile and your body will thank you.
Well said. This deep dive has been a fantastic journey through the world of preventative and corrective oral appliances and the importance of overall oral health. We hope you've enjoyed it as much as we have. Remember, knowledge is power, and now you have the knowledge to be proactive about your oral health. Until next time, keep smiling.